Hello everyone. Today we are going to learn about the bone femur. As you know, femur is a bone which lies in the thigh and it is the longest and strongest bone in human body. Now let's see which are the main parts of femur. Femur consists of three parts: an upper end, a shaft and a lower end. So here this much part forms the upper end and here comes the shaft and this much part forms the lower end. So these are the three main parts of femur: upper end, shaft and lower end. Now coming to the upper end consists of further four parts. These are the head, then the neck, the greater trochanter and the lesser trochanter. So head, neck, greater trochanter, lesser trochanter, these are the main parts of the upper end. We'll see these parts in detail later. Now let's see the side determination of femur. The first point regarding side determination is that the anterior surface of the shaft is convex. So here is the shaft of femur and you can see the shaft is slightly convex to one side, okay, and this convex side or this convex surface is the anterior surface. So anterior surface of the shaft is convex, or in other words, the convex surface of the shaft, it should face anteriorly, okay. And next point regarding side determination is that the head which lies at the upper end, it should face upwards and medially. So head, which is a part of the upper end, it should face upwards and medially. So imagine you are viewing this bone from the posterior aspect. You can see that the head, it faces upwards and medially, and here is the anterior surface of the shaft. It is convex anteriorly. So holding the bone in anatomical position, you can understand that this is a right side bone. This is the femur of right side. Now let's see the parts of femur in detail. So first about the upper end. Let's see the parts of upper end. Upper end consists of four parts. These are the head, neck, greater trochanter and lesser trochanter. So here, as I told you, this much part is the upper end. Upper end consists of a head and a neck, then two bony prominences. One is the greater trochanter and then the lesser trochanter. The head, neck, greater trochanter and the lesser trochanter. So before going into detail about the parts of the upper end, you should understand that in this bone, see here, this is the anterior aspect of the bone and this is the posterior aspect of the bone. So we have already discussed the determination of side and you should keep this in mind while understanding the rest of the points. Now let's see the first part, that is the head, in detail. So here is the head of femur. The head projects from medial side of the upper end. So this is the upper end and the head projects from the medial side of the upper end and it faces upwards, forwards and medially. So when you hold the bone in anatomical position, the head, it faces upwards, slightly forwards and medially. Then the head articulates with the acetabulum of hip bone. So here at this part, the head articulates with the acetabulum of hip bone. So here is the hip bone and this cavity is called as acetabulum or acetabular cavity, and to this acetabular cavity comes the articulation of the head of femur. Now there is a small depression present at the center of the head, that is here you can see one small depression which is present in the center of the head and it is named as foveus or pit. The pit or foveus, it gives attachment to the ligament of head of femur. Now the next part is the neck. So here comes the neck. Neck is a constricted part attached to the head, a constricted part attached to the head of femur, and the neck joins the head to the shaft, forming an angle. So the neck, it forms an angle with the shaft. So you can see this is the long axis of the shaft and this is the long axis of the neck, and the long axis of the shaft forms an angle with the long axis of the neck, and this angle, it is about 125 degree, and this angle is known as angle of inclination. Angle of inclination is the angle formed by the neck with the shaft. Next is about the greater trochanter. The greater trochanter, it is a large quadrangular prominence which projects upwards from the junction of the neck with the shaft. So here comes the junction of the neck with the shaft, and here there is a prominence which projects upwards, and this is the greater trochanter. The medial surface of the greater trochanter has a depression called as trochanteric fossa. Here you can see a depression over here, and this depression is called as trochanteric fossa. So here is the greater trochanter. The greater trochanter, this much part is the greater trochanter. Now let's see the muscle attachments coming on to the greater trochanter. The first muscle is the gluteus minimus muscle. The gluteus minimus muscle gets inserted onto the anterior surface of the greater trochanter. Here is the anterior surface of greater trochanter. Then next muscle is the gluteus medius muscle. The gluteus medius muscle, it gets inserted onto the lateral surface of the greater trochanter. Here is the lateral surface of the greater trochanter. Next is about the lesser trochanter. So here comes the lesser trochanter. The lesser trochanter is a blunt conical projection at the inferomedial part of the junction between the neck and shaft. So here is the neck, here comes the shaft, and here is the junction between the neck and shaft, and lesser trochanter is a conical projection present at the inferomedial part of the junction between the neck and shaft, and it faces medially and backwards. So as you can see from here, the lesser trochanter faces medially and backwards. And the lesser trochanter, it gives insertion to two muscles. These are the psoas major and iliacus. Now there is an oblique ridge present at the anterior surface of the upper end, and this ridge is known as intertrochanteric line. So here this is the anterior aspect of the upper end, and here you can see one rough oblique ridge present here, and this is the intertrochanteric line. So intertrochanteric line is a rough oblique ridge. It is present at the junction between the neck and the shaft in the anterior surface, and this intertrochanteric line, it is continuous below and posteriorly as another line or another ridge known as the spiral line. So here is the intertrochanteric line. It continues below and behind as another line called as spiral line. You can see the spiral line here. Now here is the intertrochanteric line, and it continues below and behind as the spiral line. So intertrochanteric line and spiral line marked here. Now let's see the muscle attachments coming in the intertrochanteric line. The intertrochanteric line gives origin to two muscles. The first one is vastus lateralis. Vastus lateralis muscle takes origin from the intertrochanteric line, and the next muscle is vastus medialis. It also takes origin from the intertrochanteric line. Now another attachment coming in the intertrochanteric line is the capsular ligament of hip joint. We are going to talk about another ridge present in the posterior aspect of the upper end. So here what you see is the posterior aspect of the upper end, and you can see a small rounded ridge which is placed at the junction between the neck and the shaft, and this small rounded ridge present in the posterior aspect of the upper end, which is present at the junction between the neck and the shaft, it is known as intertrochanteric crest. So literally the intertrochanteric crest it is a ridge present between the two trochanters, the greater trochanter and the lesser trochanter, and that's why it is named as the intertrochanteric crest. So here comes the intertrochanteric crest, and there is a low rounded tubercle or an elevation present in the intertrochanteric crest, and this tubercle is called as quadrate tubercle. So quadrate tubercle is a low rounded elevation present in the middle of the intertrochanteric crest. This is the quadrate tubercle, and this quadrate tubercle, it gives insertion to one muscle called as quadratus femoris. Now we have seen all the parts of upper end. Let's move on to the shaft. Here the part extending from here to here is the shaft, or in other words, the shaft connects the upper end and the lower end, and the shaft, as you can see, it is narrow in its middle part and it is expanded in its upper and lower parts. Shaft possesses 3 borders and 4 surfaces in its upper 1/3 and lower 1/3, and only 3 surfaces in its middle 1/3. Now the 3 borders are lateral border, medial border and posterior border. So here this is the lateral border, and here comes the medial border, and here what you see right here is the posterior border. And when you examine the lateral border and the medial border, you can see that these both borders are rounded and ill-defined. And the posterior border is rough like a crest, and it is very prominent. Now the shaft consists of 4 surfaces in its upper 1/3 and lower 1/3. This is due to the fact that in the upper 1/3 and lower 1/3 the shaft is expanded, and that's why one additional surface is there. Now in the middle 1/3 only 3 surfaces are there, and these 3 surfaces are the anterior surface, lateral surface and medial surface. So here comes the anterior surface, then here comes the lateral surface, and here comes the medial surface. So these are the 3 surfaces in the middle 1/3. Now in the upper 1/3 and the lower 1/3, since the shaft is expanded, there are 4 surfaces. One additional surface is there in the upper 1/3 and lower 1/3, and these are the upper posterior surface and lower posterior surface. That is, in the upper 1/3 and the lower 1/3, the posterior border, it splits to enclose one surface at the upper 1/3 and lower 1/3. So here is the posterior border, which is thickened like a crest, and this posterior border, when it reaches the upper 1/3, it splits to enclose another surface over here, and this is the upper posterior surface. And the posterior border, when as it comes down, it splits to enclose one surface over here, and this surface is called the lower posterior surface. Now let's see the borders of the shaft in detail. So first about the lateral border. So here is the lateral border, and next comes the medial border. Here is the medial border. So as I told, these lateral and medial borders are rounded and ill-defined, and the lateral border, it separates the anterior surface from the lateral surface. Similarly, the medial border, it separates the anterior surface from the medial surface. Now coming to the posterior border. The posterior border is the most important among all the 3 borders. It is also called as linea aspera. So here comes the posterior border, and as I told earlier, the posterior border towards its upper end, it splits into 2 and it encloses the upper posterior surface. Then coming down here, the posterior border, again here also it splits into 2 parts, enclosing one another surface here, that is the lower posterior surface. At the middle 1/3 part of the shaft, the posterior border is in the form of a thick roughened crest, and the posterior border possesses a lateral lip and a medial lip. So here the posterior border is present as a thick roughened crest, and it consists of 2 lips or 2 boundaries, and these are the medial lip and lateral lip. So here comes the medial lip, and here comes the lateral lip of the posterior border or the linea aspera. So here is the medial lip of linea aspera and here comes the lateral lip of linea aspera, and there is a small space intervening the medial lip and the lateral lip, and this is known as the intermediate area. The medial and lateral lips, they diverge from each other as they are traced above and below. Now the medial lip, here comes the medial lip of linea aspera. It is continuous above with the spiral line, which we have already seen. Here comes the spiral line. So the medial lip of linea aspera is continuous above with the spiral line, and it is continuous below with another ridge over here, and that is known as medial supracondylar ridge. Now the lateral lip, here comes the lateral lip of linea aspera. It is continuous above with another tuberosity here, and that is called as gluteal tuberosity. So the lateral lip of linea aspera is continuous above with the gluteal tuberosity, and the lateral lip is continuous below as another ridge called as lateral supracondylar ridge. So once again, the posterior border, it is also called as the linea aspera. It consists of a medial lip and a lateral lip and an intermediate area. The medial lip is continuous above with the spiral line and is continuous below with the medial supracondylar ridge. The lateral lip is continuous above with the gluteal tuberosity and is continuous below with the lateral supracondylar ridge. Now let's see the surfaces of the shaft. The three surfaces present in the middle 1/3 are the anterior surface, lateral surface and medial surface. So here comes the anterior surface. It lies between the medial border and the lateral border. So here comes the anterior surface. It lies between the medial border and the lateral border. Next is the lateral surface. So here comes the lateral surface. It lies between the lateral border and the posterior border. And next is the medial surface. Here comes the medial surface. It lies between the medial border and the posterior border. Now let's see the additional surface present in the upper 1/3 part of the shaft, that is the upper posterior surface. The upper posterior surface lies between the spiral line medially and the gluteal tuberosity laterally. So here is a spiral line and here is a gluteal tuberosity, and this spiral line, as we have seen earlier, it is continuous above with the intertrochanteric line here, then the spiral line, and the spiral line, it is continuous below as the medial lip of linea aspera. And then about the gluteal tuberosity, here's the gluteal tuberosity. This gluteal tuberosity is a broad, rough ridge which is continuous below with the lateral lip of linea aspera. Now about the additional surface present in the lower 1/3 of the shaft, that is the lower posterior surface. Lower posterior surface lies between the medial supracondylar line and the lateral supracondylar line, which we have already seen. That is the medial supracondylar line. It is continuous above with the medial lip of linea aspera. Then the lateral supracondylar line, it is continuous above with the lateral lip of linea aspera. Now this lower posterior surface, it is also called as popliteal surface because it forms the floor of popliteal fossa. Now let's see the important muscle attachments on the shaft. So the first muscle is the vastus intermedius. It takes origin from the shaft. Then next muscle is the vastus lateralis. It also takes origin from the shaft. Then next is the vastus medialis. It also takes origin from the shaft. And next muscle is the adductor magnus, which is inserted to the shaft. Next muscle is the gluteus maximus, which gets inserted into the gluteal tuberosity over here. So here the gluteal tuberosity, which gives insertion to the gluteus maximus muscle. And next muscle is the biceps femoris, the short head of biceps femoris. It takes origin from the lateral lip of linea aspera and the upper half of the lateral supracondylar line. So here is the lateral lip of linea aspera, and here comes the lateral supracondylar line, and the lateral lip of linea aspera along with upper half of the lateral supracondylar line gives origin to the biceps femoris muscle, short head of biceps femoris muscle. And next muscle is the gastrocnemius muscle. The medial head of the gastrocnemius muscle takes origin from the popliteal surface. So this lower posterior surface, it is also called popliteal surface, it gives origin to the gastrocnemius muscle medial head. Now that we have seen the details about the upper end and the shaft, let's move on to the lower end. So here is the lower end. The lower end, as you can see, it is broadly expanded, and the lower end consists of two prominent thick masses of bones, and these are called the medial and lateral condyles. So here is the medial condyle and here is the lateral condyle, and these are two prominent thick masses of bones present in the lower end, and this medial condyle and lateral condyle are separated from each other by a fossa over here, and this fossa is called as intercondylar fossa. So medial condyle, lateral condyle and intercondylar fossa. Apart from these, two articular surfaces are also present in the lower end of femur. These are the patellar articular surface and the tibial articular surface. The patellar articular surface articulates with the patella, and the tibial articular surface articulates with the tibia. So here you can see one smooth part which extends this much. This smooth part is the articular surface. So when you examine this specimen, this smooth part which you see is the articular surface present in the lower end of the femur, and this articular surface, it is divided into two parts, the patellar articular surface and the tibial articular surface. So patellar articular surface is the part which comes anteriorly, the part which articulates with the bone patella, and this much is the patellar articular surface. And tibial articular surface comes inferiorly and posteriorly. So this much is the tibial articular surface. Tibial articular surface is this much is the tibial articular surface. So finally the parts of the lower end are the lateral condyle, the medial condyle, then the intercondylar fossa, then the patellar articular surface, and then the tibial articular surface. Let's look into the lateral and medial condyles. So here is the medial condyle and here is the lateral condyle. The one which is present medially is the medial condyle, and the one which is present laterally is the lateral condyle. And first let's look on to the lateral condyle. So lateral condyle, as you can observe, it is smaller than the medial condyle. The medial condyle is slightly larger. The lateral condyle is smaller than the medial condyle, but still it is stronger than the medial condyle. The lateral condyle is smaller but stronger than the medial condyle, and there is a elevation present over the lateral aspect of the lateral condyle, and this elevation is called as lateral epicondyle. So here you can see the lateral epicondyle. It is a low rounded elevation present on the lateral aspect of the lateral condyle. This lateral epicondyle gives origin to one muscle named as gastrocnemius, the lateral head. The lateral head of gastrocnemius takes origin from the lateral epicondyle. Now coming to the medial condyle. So here is the medial condyle, and medial condyle, it is more prominent than the lateral condyle. It is larger and more prominent than the lateral condyle. And there is a small projection at the upper part of the medial condyle. Here is the medial condyle, and here you can see a projection here in the upper part of the medial condyle, and it is a tubercle, and this tubercle is named as adductor tubercle. So adductor tubercle is a small projection at the upper part of the medial condyle, and this adductor tubercle gives insertion to one muscle called as adductor magnus muscle. Now there is an elevation present in the medial condyle, that is here it is known as medial epicondyle. Similar to the lateral epicondyle, there is a low rounded elevation present on the medial aspect of the medial condyle, and this elevation is called as medial epicondyle. Now coming to the intercondylar fossa. So here is the intercondylar fossa. It is present in between the two condyles and it separates the two condyles, and you can see there is a margin or a line of separation between the intercondylar fossa and the popliteal surface over here. This line which separates the intercondylar fossa from the popliteal surface, this line is named as intercondylar line. Intercondylar line. Now let's see some important attachments coming in the condyles and the intercondylar fossa. So first is the anterior cruciate ligament. The anterior cruciate ligament is attached to the medial surface of the lateral condyle. So here is the lateral condyle and here comes the medial surface of the lateral condyle. So medial surface of lateral condyle gives attachment to the anterior cruciate ligament. Next is the posterior cruciate ligament. The posterior cruciate ligament is attached to the lateral surface of the medial condyle. So here is the medial condyle and here comes the lateral surface of the medial condyle, which gives attachment to the posterior cruciate ligament. And then the intercondylar line here, it gives attachment to the capsular ligament of knee joint. Finally, coming to the articular surfaces of the lower end of femur. The articular surface, as I told earlier, here comes the articular surface, the smooth surface which you find over here. The articular surface is divided into two parts, the upper patellar surface and the lower tibial surface. So here is the upper patellar surface, and this upper patellar surface is for the articulation with patella, and here comes the lower tibial surface, and this lower tibial surface is for articulation with the condyles of tibia. Now here is the bone tibia. The upper end of tibia consists of two condyles, a medial condyle and a lateral condyle, and these medial and lateral condyles of tibia articulates with the lower tibial surface present in the lower end of femur. That's all about the bone femur. I hope you found this video helpful. Thanks for watching.